my name is Michelle Mahoney. I'm a clinical skills practitioner at University Hospital Coventry in Warwickshire. I'm now going to demonstrate the procedure for the insertion of an intravenous peripheral cannula. First, I'm going to start off by washing my hands using soap and water away from my patient. Then when I enter my patient's bed space, I'm going to gel my hands using the A-lift technique, and I'm going to introduce myself to the patient. I'm then going to identify the patient and check the identity of the patient against the wristband. I'm then going to obtain informed consent, ensuring that I thoroughly explain the procedure to the patient, the reasons for inserting the cannula, and any potential cautions, contraindications and complications. I'm then going to check the allergies of the patient, check if they're on any anticoagulation therapy, and ask them if they have any questions. Once we're both happy, I'm then going to go and collect all my equipment, ensuring that I check the expiry dates, and I'm going to go and clean my tray. I'm now going to return to my patient, I'm going to gel my hands, and I'm going to apply my apron. Okay, I'm going to visually inspect the arm, starting with the hand and checking for which vein I would like to use and any obvious signs why I wouldn't want to use a potential site. So I'll be checking for any signs of bruising or infection or any previous puncture sites. And I'm quite happy that I'm going to go for this area here. Okay, I'm now going to open my pack and arrange all the equipment within my pack, ensuring that all the key parts are protected. In this trust, we use aseptic non-touch technique, and that is a standard approach, and that is protecting all of the key parts. I'm now going to open my cannula, ensuring that I choose the smallest cannula for the required flow rates in the largest vein. I'm going to place the drape underneath the patient's arm. And I'm going to apply the tourniquet approximately 10 centimetres above the potential puncture site. You need to make sure that the tourniquet is not too tight, so you should be able to get 2 fingers underneath the tourniquet and you should be able to feel a radial pulse. I'm then going to palpate the vein, making sure that it's bouncy and firm and relatively straight. I'm then going to remove my tourniquet. Your tourniquet shouldn't stay on any longer than 2 minutes for this procedure, unless you're taking blood, and then it's just a minute. I'm now going to gel my hands, and I'm going to apply some gloves, some non-sterile gloves. Next, I'm going to prime my bioconnector. For this, we use the pre-filled syringe of 0.9% sodium chloride, and I'm going to check the expiry date. As this is going to be given intravenously, it needs to be prescribed on the patient's drug chart, and it needs to be checked by 2 healthcare professionals. To do this, we take the top off the flush, we attach it to the end of the bioconnector, screw it on there, and we flush that through. I'm now going to clean the patient's skin. So we use the cleansing wipe that's in the pack, and we clean the area 30 seconds using the crosshatch technique. And then we leave it to dry for 30 seconds. Okay, I'm now ready to insert my cannula. I'm going to pop the tourniquet back on, again ensuring that it's not too tight. I'm going to take my cannula, I'm going to stretch the skin, and I'm going to insert the cannula at a 20 to 35 degree angle. Until we see a flashback of blood in this chamber here. Once you have your flashback, you stop, lower your angle slightly, Advance your cannula 2 to 3 millimetres just to ensure that it is in the vein. You then hold the cannula still, pull the needle out the back until you see a run of blood up the needle, and that's your second flashback. Once you've seen that, hold the needle still and you advance your cannula over the needle. Okay, you then take your tourniquet off. Now here you can either apply pressure above the insertion site, or you can pop some gauze just underneath just to catch the blood as it comes out. Okay, you take the needle out, pop it straight in the sharp spin, and you're going to connect up your bioconnector. So take the end off there and pop that onto your cannula. Take your gauze out. I'm then going to secure it down using the wings on the dressing. And I'm going to flush the cannula using a pulsatile technique. And I'm going to check with my patient that it feels okay. My patient should say that either they can't feel anything at all, or that it feels cold going up their arm. If there's any signs of swelling or bruising, or your patient tells you that it's painful, then you must remove the cannula immediately. Okay. You then disconnect the syringe from the end and leave the bioconnector attached there. Then apply your dressing by taking the back off and putting it as high up to the cannula as you can, ensuring that the insertion point of the cannula is visible within the window so that you're able to check for any signs of phlebitis or infection. Take the top of the dressing off here. I'm then going to take my gloves off. I'm going to write the date and my initials on this sticker here, and I'm going to apply that to the side of the cannula. I'm then going to wash my hands using soap and water and the ALIF technique. I'm going to fill in all the relevant documentation, and I'm going to thank my patient. Okay, so you need to peel this sticker off here, pop that into the medical notes, and complete the relevant information into the notes. So I've just demonstrated the procedure using national and local policies to University Hospital Coventry and Warwickshire. Please remember to follow the policy of the local trust in which you are working. Thank you very much.